Oh, hi, honey. How are you doing?
feeling? I'm good. How are you?
I'm feeling a lot better.
Good. Can you breathe a little bit better today?
Yes, so much better. Oh my goodness. Thank you, God.
Okay, so I'm your doctor again today.
Okay.
Do you remember me from yesterday?
Yes, I remember the pretty hair you have.
Oh, thank you.
Do you like my hair?
I love it. Nice
Thank
hair.
you.
So yesterday you were having a hard time breathing.
Yes, it was really bad, honey.
Mm-hmm. And you have a history of 30 pack years of smoking, is that correct?
Yeah, something about like that.
Okay. And do you remember doing the pulmonary function test yesterday?
The what, honey? I'm sorry.
The pulmonary function test is when you exhaled into that tube and we measured you
Okay.
were blowing into.
Yeah.
Yeah,
Oh,
that's
yeah.
the one.
That one.
Okay, well, so we got the results for that, and your forced expiratory volume, which is how much you were breathing out, is 60%.
Oh, is that good?
Well, normal is 80 to 120,
Okay.
and so this indicates, on top of, your smoking history too, that you have moderate COPD.
Oh my goodness. Is that deadly?
It's a treatable disease, so I'm going to sit down and talk to you about that and kind of explain that to you a little bit.
Okay.
And so it stands for chronic obstructive pulmonary disease.
Oh, I see.
It is characterized by chronic inflammation of your airways, and your airways branch into smaller airways, so those are also inflamed along with the lining of your lungs.
Okay.
Okay, and this inflammation begins from smoking. A lot of times it's one of the number one risk factors.
Oh,
for
but
it.
I don't smoke anymore. I quit
you
last
quit?
night. Yes.
Oh, that's great to hear. That is great to hear. Well, unfortunately, COPD is progressive,
Oh.
and so there's no necessarily going back. But it's great that you've quit now because that's still really helpful for your lungs.
Okay.
So COPD also causes airflow limitation and obstruction, and you're going to have a lot of mucus in your lungs. Have you felt that way?
Yes. In the morning, I wake up my husband every morning, just hacking it up.
Yeah, that's a normal symptom. You might also feel like it's harder to exhale because
Yes.
air is going to be trapped in your lungs.
Yes, I do.
Mhm.
I do feel that.
Okay, so your lungs are overinflated, and that damages them, and that's also one of the reasons why you're feeling that shortness of breath and activity intolerance.
Oh, I see. Yeah, when I walk up those stairs, honey, you don't even know. I can't even breathe. I feel like I'm about to die.
Oh, okay, so
Yes.
I know that must be really difficult for you, so I prescribed you a couple of medications to help you with those symptoms.
God bless you, honey. Thank you so
Oh,
much.
you're welcome. I'm glad I could help. And so my nurses, they're really familiar with these medications and
Okay.
inhalers.
Okay.
So I'm going to have them teach you about that.
Breath, honey.
Good morning.
Hi.
My name's Taylor. I'm your nurse again today. How are you doing, Miss Hacks?
Just a little harder breathing right now.
You're feeling a little short of breath?
Yeah.
Okay.
Yeah, hi. I'm Jenna. I'm her daughter.
Nice to meet you. And the doctor was able to talk to you too?
Yeah.
Okay. Good. Do you feel like you have a good understanding of the COPD right
Yeah.
now? Do you have any questions about it?
No.
Okay. So your doctor, she prescribed you this albuterol inhaler and the Advair. So this one we can use right now since you are feeling short of breath, and it should help you with your breathing. And then the Advair is due right now too, so we'll go ahead and use both of them, and I'll show you how to use them, okay? Okay. So this is the albuterol. It's a short-acting beta agonist. It's going to work quickly to open up your airways and help you breathe better.
Oh, good. Okay.
Okay, so to use it, if you're using it for the first time, you're going to want to prime it. So you're going to shake it vigorously for about 30 seconds. And then away from your face, take the cap off and press down on the canister 3 times. So I'm going to go ahead and do it for you right now to prime it. So it was 3 times. And then if you're using it regularly and you don't need to prime it, you're going to shake it yourself for about 15 seconds. Take the cap off. Now you're going to take a deep breath in and then out. And after you take the breath out, you're going to put it in your mouth, press down and breathe in. And now hold your breath for 10 seconds. Okay, and you can breathe out. Good. So That should help. It's
Oh, yes.
should work
Much,
quickly.
much better.
Does that feel better?
Mhm.
Okay, good. So this one can be used as needed. Your doctor's prescribed you. You can use it twice as you need every 4 to 6 hours. So 2 puffs. If you are going to take the second dose, you should wait 1 minute in between the first and the second.
Okay. And what are the side effects of this medication?
So it can make you feel, you can increase your heart rate. It can make you feel kind of jittery, a little nervous.
Okay.
You might get a little throat irritation from the medication.
Mhm.
But it just should only last a little while and it should clear up, okay?
Okay.
And then this one, it's important to use this one before you use your Advair if you're using them at the same time because
Oh,
it helps
okay.
to open up your airway.
Okay.
And then this one will be able to get into your lungs more easily.
Oh, okay. That makes sense.
Okay? And
Mhm.
then this one, like I said, is only used as needed and it's, we call it your rescue inhaler. So use it when you're short of breath and when you're feeling like you need it.
Just like.
This is called a spacer. So you can use
Okay.
this at home, and this helps to get the medication deeper down into your lungs,
Mhm.
and it helps a little bit with the coordination of breathing and pressing down.
Right.
So all you'll do with this one is you'll shake it like we did when you
Mhm.
use it, and put it in here,
Mhm.
and then you take this cap off. You'll put your mouth on here, and then you'll press down once on the canister, and it'll fill this with the medication. And then like you did with this, you'll breathe out, put your mouth on there, and then breathe in as deeply as
Okay.
you can. Then hold it for 10 seconds, and then
Mhm.
just breathe out.
Okay.
Okay? And then both of these things should be washed. The inhaler, all you have to do to wash this one is take the cap off, take the canister out.
Mhm.
You'll run warm water through the top here, and then warm water through the mouthpiece.
Okay.
And then let this, with the canister out, let it air dry on a clean towel
Mhm.
until it's dried completely, and then you can put the canister back in. Make
Okay.
sure not to get the canister wet though,
Okay.
okay?
Mhm.
And then this one, same thing, you'll just take this off, and you'll take this off, and you'll let warm water run through here, and then, or you can wash it with warm soapy water and let it air dry.
Okay.
And then your inhaler canister should be washed every week,
Mhm.
and this one can be washed monthly and
Okay.
should be replaced like every year or so.
Okay.
Okay? So this one is your Advair. This one is different than the albuterol. This one has 2 medications in it. It's a combination. It has salmeterol and fluticasone.
Mhm.
So salmeterol is a long-acting beta agonist, so
Okay.
similar to the albuterol, however, it's going to work long-term. So this one just helps to prevent a COPD exacerbation. It doesn't, it's not going to rescue you.
Oh, okay.
So-
So I can't use it like how I did with the other one.
No, and this one has, you're going to use twice a day, every day, at morning and at night.
Okay.
You want at least 12 hours in between the time that you use it in the morning and the time you use it at night. So this one will be used on a regular basis. The other medication in there is fluticasone, which is a corticosteroid, and that will help to open up your, or reduce the swelling in your airways.
Okay.
Okay? So this one, you'll open it up like this, and you're due for this one too, so we can go ahead and try it. So you'll hold it horizontally in one hand,
Okay.
and then with this hand, you'll use your thumb. You'll press the lever down until you hear it click.
Okay. So.
Okay, you heard the click. And then you'll, again, same procedure. You're going to breathe in and then out.
Okay.
And then you're going to put your mouth on the mouthpiece and breathe in forcefully and deeply with that one. Good. And then you hold for 10 seconds again. And then you can breathe out. So with that one, that's a powder medication in there. You might not feel or taste the medication in your mouth, but that's okay because it's
Okay.
just make sure you don't take another dose. And then this one does not need to be washed because, like I said, it's powder, so you don't want to get it wet, so you'll store it
Okay.
in a dry place. Cause you to feel a little scratchy in your throat also,
Oh, okay.
and some hoarseness, but
Okay.
it should resolve, okay?
Okay.
One other important thing with this one, it has a corticosteroid in it,
Mhm.
so you want to make sure every time you use it that you're rinsing your mouth with water. So go ahead, since you used it. You'll rinse and swish water around your mouth, and don't swallow it. So that's just to prevent a yeast infection you can get in your throat because of the corticosteroid. Can cause some white patches back there, but by rinsing it should help to prevent that.
Okay.
Okay.
Mhm.
Do you have any questions right now?
Nope.
Okay. I printed some information for you on how to use your inhalers. So you can take this home with you, and if you have any questions, you can call us or you can call your pharmacy, and they should be able to clear any questions up.
Okay.
Okay?
Thank you.
You're welcome.
See.